You're listening to the Toe Talks podcast. Today, we bring awareness to the atrocities that hospitalized patients endured during the scam-demic, the inhumane practices, egos, discrimination, and medical failures that were perpetrated on patients by the medical community itself. We will spotlight how healthcare professionals stopped critically thinking, stopped practicing evidence-based medicine, and stopped allowing for bodily autonomy. Hospital administrators told physicians how to practice medicine while holding their jobs as leverage and exchanged the health of human beings for governmental, pharmaceutical, blood money. Stick around. You're not going to want to miss it. We are the rugged, authentic savvy, and you're in the right place. Live free, pursue health. Powerful living starts in 3, 2, 1.
They have basically kidnapped him. I nearly got arrested because the freaking protocols for the hospitals are killing people. You put them on remdesivir and a ventilator, and they die. Nothing is about patient health right now. It's all stacked against patients, and I'm somebody who's educated. I don't know what people do. They just are blindly led by these people, and nobody questions them. And let me tell you, when you question a doctor, you challenge them one time, they lose it. They become a hot mess.
I'm in the twilight zone right now. What the hell is happening? This is a nightmare. Oh, sweet Jesus. I don't know what to say. It's only gonna be Jesus. That's all I gotta tell you right now. He's the only way right now.
What you are about to hear is a very raw and very personal story about the COVID hospital ovens. We must tell our stories, and the world must never forget them. But we won't stop there. We'll chat about the good that can be found in the evil and the important takeaways that can be gleaned from the events that unfolded in the fall of 2021. Welcome to episode 10 of the Toe Talks podcast, The Hospital Ovens and Patient Prisoners, Part 3. We're going to pick up where we left off from our story. Lee was all alone in a hospital, an hour away from his family, and left to advocate for himself and his health. Before we move on to this new hospital, back to the ER for a second, I just remembered I had a memory of this same individual that said, "This isn't Burger King." Lee, do you remember what happened when she came back into the room with the physician to talk to you? Do you remember the conversation that ensued after that? Okay.
I'll remember when you say it, probably, but not.
So this very same person. So the nurse was, the doctor was actually telling Lee what we're going to do for you. And they were going to go ahead and give him antibiotics and budesonide. They were going to give him children's vitamins, basically, or, under the dose of what he really needs for being sick, these vitamins. But I was like, hey, whatever, it's better than nothing. And then this nurse or this healthcare worker that said, "This isn't Burger King," puts her hand on Lee's arm and says, "This is your rodeo. You get to decide what to do, what we're going to do." And I was like, oh my gosh.
Yeah, I do remember that.
And Lee was like, "Get your hand off of me." Anyway, okay, so let's go back to this transfer. You're in a new hospital, hour away. What does your room look like, Lee?
Well, it was at night, so it was kind of hard until the next morning to realize that everything's blocked up. All the windows are blocked up. They have some kind of ventilator fan ductwork that's blocking that window.
I think it was a filtration system of some sort, probably.
So yeah, dark and you can't see out.
Yeah, so no natural light.
Right.
For the entire time, we'll talk about how long you're actually in the hospital for. We'll get to that in a minute too. But the entire hospital stay, do you ever see a human being's full face?
Oh no, everybody's required to wear a mask. Well, I will say yes, but it was because they had the shield.
Mm-hmm. Right.
But some of them were both, the shield and the mask.
What about taking a shower?
Never took a shower while I was there.
And why was that?
I'm not sure if they thought I could get up to go. Maybe that was what they were thinking. But when I did go to the bathroom, when I could go to the bathroom on my own or with help, there were in my shower was a stack of chairs of like
COVID supplies is what you
COVID
had
supplies and like handicap chairs. I can't remember what those things are called.
Mm-hmm. Yeah, handicap like shower chairs and stuff.
They were just all stacked
Wheelchairs
up in there,
and-
so
yeah.
there was no space.
It was basically storage.
All right.
And they wouldn't move it. We asked them to, and they would not move it. And, you were mobile because you were getting up to go to the bathroom on your own accord in order to get exercise. Did a nurse ever come in and bathe you to give you like a dry shower bath of sorts, with dry
No.
shampoo or wipes?
No, never got any of that. They did when I asked. I think I asked. Eventually asked for something to help clean up, and they brought in those
wipes. Yeah.
that were big. They were very large, and they were very useful. But no one. I mean, they just brought them for me to do myself.
Yeah. You were on your own, mister. People did not want to stay in his room any longer than they had to. All right. So you're in a room without natural lighting, no way to shower, and rarely ever seeing a human face or feeling a human touch because everybody's got gloves on and gowns on. What were your interactions with healthcare workers in general? So doctors, well, actually, we'll do doctors in a second. Let's just talk about nurses, techs, and therapists. Is there anything that's good or bad that stands out to you?
I guess the word would be good, bad, and ugly. I mean, there were some that three male nurses were awesome. And let's just start with those because they were amazing men who seemed to really care about their job and care about me. All three professed belief in Jesus, and we talked about that. One even came back after his shift to pray with me. And so just great and helped me in this whole process just have some sanity. And then there's the middle ground folks that just kind of did their job. But the ugly are the ones that I could not understand what they said. And then they had a mask on. And so on top of that, it was, a foreign, person.
Had an accent.
Had an accent. So that was hard with a mask on and had to just ask multiple times to repeat what they said. And then we'll probably talk about this, but just they would come in after getting reports of my oxygen level, they'd come in and ramp up the oxygen.
Oh, yeah, we'll get to that. Yeah, that's going to come. We're going to talk about that. What about physicians? What was your interaction like with physicians in general?
I would say positive in general. Very, very nice, informative. Some would I know some would, eventually said, hey, I'll put it in your chart not to raise the oxygen level.
Oh, and that's a story that we'll come to as well. But that was only one amazing PA. You and I have different outlooks on that one. I think we ran into two physicians that were excellent. The rest of them were terrible.
Yeah, and they switched too often. That was the worst part. I couldn't get consistency in care. I'd like one and then they'd be gone.
Mm-hmm.
So yeah, that was
tough.
tough.
I think it was like every 5 days or something like that. Sometimes faster than that. And I do remember one specific physician. You could tell she was afraid to be in the room with you. She didn't bring in the computer with her. When I asked her to check something, I'm on the phone and we're going silent and I'm thinking she's looking at the computer to check for the information. And she goes, hello? And I go, hello? Are you looking for did you find the answer? Oh no, the computer's outside. Why is the computer outside? You're the only physician that left the computer outside. And then she goes, well, I gotta go. I'm being paged. And I'm thinking, no, you're not, but bye, because obviously you are not going to be helpful. Probably the most frustrating part for me as far as interactions with physicians was every time I asked for something, their answer would be no, because that is not the COVID protocol. Or their answer would be, he just needs time. And I'm thinking, but you're not doing anything. You're not doing anything. You're just waiting. When in the world have we ever waited in medicine and not actually try to be proactive? So that was probably for me in being in the medical profession, so incredibly frustrating because I know this is not the norm. I've seen it in the hospital. I know what doctors do. I know what nurses do. I'm a physical therapist. We're side to side, buddy, buddy all the time in acute care and outpatient. So what was the protocol? The COVID protocol was basically, depending on when you were in the hospital, they might have started heparin for you. That should have been a absolutely something that you would do for somebody who has COVID, because they figured out that this was a clotting issue. People would get blood clots or PEs in their lungs, and they wouldn't go away, which is an organizing pneumonia. So heparin was sometimes given to you, but it should have been right away. But typically, the mainstays for the COVID protocol were maybe steroids, heparin, remdesivir, and then eventually a ventilator. Problem was, Lee was on steroids, which is good. That is probably the number one thing every COVID patient needed to be on. But the problem was, none of them were on a therapeutic dose. And then they were on the wrong steroid. He was on 6 milligrams of dexamethasone. That's like a Tic Tac. And then when I asked for percussive respiratory therapy for him, and of course they said, that's not in the protocol. Percussive respiratory therapy was not in the protocol. Okay, people. Should be the standard.
Was that PT? That's not PT. That was respiratory.
Yeah, respiratory should do it. Although PT can do it, but generally, that's kind of an overlap between the two circles, but generally it is respiratory's job. And here's the other insidious thing that drove me nuts. We were lied to when he was transferred from one hospital to the other. And I remember saying to the physician that was going to sign the orders to have him transfer, are his current treatment's going to transfer over? His current plan of care will stay the same. And she was like, I can't guarantee that. Of course, then there was a nurse that said, yeah, I'll make sure that what they're doing for him right now will go with him to the next hospital. It didn't. I remember talking to the nurse who had admitted him, and I said, what are you going to do for him? Oh, we can give him remdesivir. And I'm like, oh, no. And then she goes, and we'll give him heparin and a steroid. Okay, great. And I said, but wait a minute, you're going to give him heparin and a steroid, but he hasn't seen a doctor yet? How do you have orders if he hasn't seen it? Oh, they're standing orders for COVID. I'm like, okay.
That's the protocol.
Yeah. Hello. I mean, medicine is always treat the person in front of you. And this is the biggest problem. One of the biggest problems that happened in the hospitals is that everybody was treated the same. And the protocol was killing people. It was not helping people. Major problem here. Nobody wants to deviate from the script, and the script is really bad.
Lee calls me at 9:30. Hasn't been seen by a physician yet since he's been moved. There is a nurse in the room that's telling me that he wants to give him blood thinners. He hasn't been seen by a physician yet. Why does he have any orders? Oh, well, it's the standing COVID orders for all the patients. It's standardized. And I was like, oh, here we go. And I said, he has treatment protocol already put in place. Antibiotic, oral steroid, budesonide respiratory nebulizing treatments, and oxygen. Oh, no, there's none of that. There were no orders with him at all, other than the standard COVID protocol. The physician comes in. The nurse had already told them that we didn't run remdesivir, so she's already ready to question that. And she said, so you don't want remdesivir? Nope, we don't want any part of it. Well, it blah, 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 and blah, 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 and talks about all the benefits and how it helps people. And I said, no, we don't want it. She goes, are you worried about the liver? I'm like, oh my gosh. Like, no, I'm worried about shutting down his kidneys and causing lung congestion and then you putting him on a ventilator and him dying. But, well, I haven't seen that happen. Kidneys shut down because of COVID. Are you even listening to yourself? You just could not connect the dots just now? I'm sorry, but COVID doesn't cause kidneys to shut down. It's not as if there's just this new mutation that occurs in a virus that all of a sudden affects a major organ. It's the medication. So I said, no thanks. Don't want it. Had to wrestle her for everything that we had before.
After fighting to get him back on his, steroids, heparin, antibiotics, of course, we don't treat that. COVID with antibiotics, and the inhaled budesonide, which means he would get a respiratory therapist. Otherwise, he probably wouldn't have seen one. But we kept battling for physical therapy and percussive therapy. We eventually did get physical therapy. Fortunately, because I was one, I could tell Lee what to do in order to do exercises while he's being confined to this room. We'll get into why that became an issue later on. By the end of the day, on the second day of being in the hospital, so 10/14, Lee had no temperature, was feeling slightly better, actually had a little bit better of an appetite. So things were actually starting to already upswing. And I think it was because he was getting the right antibiotic. He was getting steroids, oral and inhaled. He was also getting oxygen. So I think these things were helping him to, in general, feel slightly better. Day 3, 10/15, they increased his oxygen from 4 liters to 6 liters. Day 4, 10/16, because I had told Lee, hey, you need to make sure that you are doing exercises in the bed. You need to get up and go to the door or to the bathroom several times every hour on the hour just to keep moving. But because he was doing that, the nurses, this segment of the interview, I like to call, don't do that. Because the nurses, what would they tell you, Lee, when you got up to go to walk? Do you remember?
Was it that your oxygen level dropped?
Yeah, they would say, no, stay in bed, don't move.
Yeah, because then all they'd do is come in and crank up the oxygen level again.
Yes. And I was like, okay, again, we have lost our minds, because I know that the best thing for the lungs is to exercise them in order to get the crud out. It's like flushing the toilet. This is what you do. You walk, you exercise your lungs. It's one of the best things you can do when you have a respiratory issue going on, as long as you have, the supplemental oxygen. If somebody's O2 drops and it remains that way, the person cannot compensate. Not recover. Then you do need to turn it up, obviously. But if it's just because he was exerting himself slightly and he could breathe deep a couple times and he goes back up into the 90s, there's no worries, right? But they would freak out. But the fact that they told him, don't get out of bed, was mind-blowing to me.
I told Lee, if you weren't able to correct and bring your O2 level back up to the 90s, I would be very concerned. But you are. It's going to drop whenever you do exercise. And that's another thing. The nurses are like, don't get up to go to the bathroom. Who are you people? Did you not take Pulmonary 101 in nursing? I mean, it's like they've all lost any kind of education about how you're supposed to treat somebody who has pneumonia. You have to exercise. You have to use your lungs. Sure, O2 is going to drop. He's just going to have to remember to breathe deeply or take a break. But you can't tell people to not move. That's the worst thing that you could say to somebody. Did you do a data dump and become dumb overnight? Just because COVID? I mean, really? You're going to throw everything out? So no PT, no percussive respiratory treatment, and 1 nebulizing treatment a day. I think you should just come home. Come home with oxygen, all your medications. We'll get you healthy here at home. You'll get better care here than there. And of course, I think Lee would do it, but he's very nervous about coming home. He's concerned about the dropping of his oxygen. And his morale is low, I can tell. It's very hard to watch. I actually duoed with him today, which, you video call. He just does not look good. The isolation is horrible, just mentally. And then having to be his own advocate.
Day 4, I was, again, sneaking in drugs too, Lee. I was sneaking in food, NAC, HCQ, high-dose vitamin C. I remember Lee when he got it. So, I have to drive to this hospital, basically drop it off, and then somebody else would run it up to him. He said, oh my gosh, they're going to get so mad at me because I had given him NAC. And that was one of the things that we had requested to give him. The doctor that I was talking to said, oh, we don't give COVID patients that. We give that to COPD patients. I was like, yeah, you give it to them because their lungs need it. And so do COVID patients.
And then I said, what about NAC? It's not indicated. It's not in the protocol. It's a supplement. We only give that to COPD patients. Exactly, because they're having lung issues. It doesn't matter if it's indicated. It's a supplement. It's not indicated. Oh my gosh. Okay, fine. What about ivermectin? It's not in the protocol. It's not CDC protocol. It's not indicated. Have you been reading the research coming out of India and Japan?
Well, I follow the CDC guidelines. I'm like, okay, so that's a no. Well, I think you're doing a disservice to your patients and especially to my husband. And then he said to me, well, if you don't want me treating your husband, I don't have to treat him. What kind of physician are you? I'm an internist, generalist, how come he's not seeing a pulmonary physician? Oh, because there are other patients, COVID patients, that are worse off than him. He has a lung pulmonary issue. Why isn't he being seen by a pulmonary physician? That's ridiculous. So anyway, Lee was sweating it a little bit that I had given him the NAC, and I was like, well, just keep it hidden so they don't take it from you more than anything.
Yeah, I had to be real sneaky.
When he opened it up, I was talking to him and he goes, oh my gosh, I'm going to get in so much trouble. Well, not really, because they're supplements. Of course, HCQ is not, but, well, I told him I wanted you to have it. He didn't want to give it to you, so the doctor can suck it. Tough Doogie Howser. I'd keep it hidden just so they don't give you a hard time. You ain't going to do what we asked you to do. We're going to do it for ourselves.
So by the close of day 4, honestly, I was ready for Lee to come home, but Lee was not. He was still not feeling comfortable, and his morale was starting to get low.
Also, the doctors they wouldn't let me go unless I had an oxygen level under 3 or something, like 2 or 3.
4. I think it was 4. Mm-hmm. But what I was telling you was that we could self-discharge and go home with oxygen. And of course, this was my only bargaining chip, my only way of threatening the hospital healthcare workers in order to strong arm them into giving Lee what we felt like he needed. I'm like, fine, if you're not going to do what we want you to do, we're going to self-discharge. And I did say that on several occasions. And of course, they would respond, that would be against medical advice. And of course, I would say, I'm highly aware of that. They didn't like that. But by this time, Lee was pretty well, I hate to say it, but he had been tortured somewhat and psychologically and conditioned by these Nazi nurses and respiratory therapists into thinking he was going to stop breathing. Then Lee was terrified he was going to not be able to breathe outside of the hospital. I am ready to take you home. We can self-discharge you. I said this to him several times in the coming future, but he just wasn't ready. The psychological oxygen game that they had played with him was definitely working on his psyche. And this manipulative behavior would begin to intensify later on. We'll talk about it as we progress through the story here. So by day 5 on 10/17, a doctor decided to put Lee on a diuretic called Lasix or furosemide because she felt like his heart was somewhat overworking and it was lowering his O2. And this is when I asked, hey, what are the DC goals here to get him discharged? Because I was ready to get him home because I really felt he was not getting the care he needed. And she said, oh, he's got to have a oxygen level that's 4 liters or lower. I'm thinking, well, that's very specific, and that's the only thing. It's very atypical. I'm like, all right, 4 liters is the goal. That's what we're going to do. His lung sounds were still not clear. I decided I was going to buy a pulse ox, bring it to him eventually, mainly because I was beginning to question whether the pulse ox that was on his finger was actually accurate.
So, just a bit of a morale crusher. It's good that he's getting better. Just not fast enough. I can tell that he's struggling with being alone, which is difficult to watch, as I'm sure you can imagine. Just tired of the nonsense, but grateful for forward motion. So that's all I got for now, and I'll keep you posted.
Day 7, 10/19, this was a turning point for Lee. Lee began a downward trend with his lung function with poor O2 saturation and no changes with anything in his symptoms in general. No change in his treatment. Every time from here on in with this downward trend that Lee was experiencing, I'd ask the physicians, what's causing this sudden downward trend? Because he was doing so well. What can we do? And their response is, this is just the way it is. They stood there wringing their hands and watching him slide downward, wanting to give him remdesivir, put him on ventilators, sedate him. They had no answers. They had forgotten how to treat simple organizing pneumonia, is really what it came down to. And the protocol was killing people. I think they simply had to increase his steroids and begin to push pulse steroids, but they didn't. Day 9, 10/21, this is where the nurses began to play an oxygen game with us. And we like to call it, let's terrify the patient. It was at this point in time that it became very evident to me and to Lee that there was a trend that was occurring every single night. So 22 hours out of the day, Lee would be on oxygen between 3 liters and 6 liters. And then in the wee early morning hours, red alert would go off. Whoop, whoop. And they would wake Lee up out of a sound sleep. And the nurses could say, oh my gosh, you got to breathe. You got to breathe. And what would they do, Lee?
Crank up the oxygen.
Crank it up. And okay, so he was on either 3 or 6 liters, and they would crank it up to 10 or 12.
12, yeah.
And then they would leave it there without even seeing if he could compensate and recover. You know, how did you feel, Lee, when you're sleeping and this happened? What was that like for you?
Oh, it was very disruptive, obviously. I didn't get it was hard to sleep anyway because of where I had to, the way I had to sleep and the thing in my nose and stuff like that. And
had a nasal cannula.
So it's just hard to sleep. So then you get woke up and it makes it even worse.
Yes. It begins to play this psychological game with the patient because they would tell him, you're going to stop breathing, which really is not true. I understand what they were trying to do. They wanted him to, because his saturation would drop to in the 80s or sometimes even the 70s. And it could have been that he was in a REM state. It was deep sleep. Who knows? Day in and day out, this is what we would start to deal with. Because if the discharge goal was 4 liters, we couldn't get him there. We would see the finish line, and 22 hours out of the day, we're there, and then all of a sudden, it would just shoot right, and they would leave it there, and then we had to whittle it back down. Not great. Not great. Not only just the nurses that this was happening with, but it would also happen with the respiratory therapist, which is so aggravating because we really needed him to have the budesonide nebulizing treatments. But what they would do is they would come in, they would turn it up as well. He might have been on 10 because of the nurses, and then the respiratory therapists would come in and they'd turn it up to 12 liters. Again, we were just, always fighting.
Lee I think he was down to 3 liters, which is considered low flow, all evening long until 4 o'clock in the morning. I don't know what the deal is with between 3 and 4 in the morning, where they woke him up again because his O2 was in the 70s. And then they took the mask off him and put the nasal cannula on him and upped his O2. They didn't even give him a chance to try to correct. When the doctor came in this morning, I basically said, why did they take his mask off? He needs to try to compensate. He needs to at least be given the chance. That's what he said. Okay, so now he's doing a psyop on Lee because, he's like, if they wait too long to try to get his O2 up, he'll pass out. So now that makes Lee worry more. And again, I pressed him. I said, yeah, so he's in the hospital. Let's give him the opportunity to try to compensate. Since you're not letting him go home, you can certainly help him compensate if he was start to have a problem. You would get to a point where you'd be like, all right, that's it. We're intervening. Give him 5 minutes.
Now we're on day 10 of the hospital ovens and patient prisoners. So this is 10/22. I get a message from Lee. It's a text message, and it does not read well for me. He's basically telling me that he woke up in the morning with his O2 dropping to 54 oxygen saturation with difficulty breathing, but was then able to recover, but it took him a while and obviously scared him out of his mind. And the doctors kept saying his lung sounds were clear at this point in time. for a couple of days now, but he was still having this downward trend. And that day 10 was definitely worrisome to me. Somehow something wasn't adding up. And the doctors would just continue to sit there and wring their hands and say, it's just going to take time.
We spoke to the doctor. Every time I say, what's the deal with his O2 saturation, they just say, oh, it's just the way COVID is. I mean, that's their pat answer. They have no answer beyond that, why he's having problems with his saturation. Oh, it's just going to take time. This is the way COVID is. Some people have been in the hospital for 20 to 40 days. The fact that the doctor said yesterday to me, well, some people, they have problems breathing and their O2 stat is low. Other people don't have labor breathing, respiratory issues, and their O2 stat is low. And I'm like, really? When? Because usually there's some sort of etiology and it's going to show up as a symptom. Yeah, so they have no answer for that. How come our respiratory therapist is not in here doing breathing exercises with them? Well, he has his breathing apparatus right now. He has that he can do. That's all he needs. I was like, no. You and I both know there are exercises that he could be doing breathing-wise to increase his volume capacity. A little apparatus that he's doing once an hour is helpful, but that's not enough. Yeah, it's not indicated. It's not needed. He's not that bad off. He's been in the hospital for 9 days now.
And now we come to it. So what, Dr. Toe? So what? Well, the so what is this. Evil never sleeps. It will come knocking at your door, but you and I need not be afraid. If we know the Lord, the God of the universe, we have everything we need on our side to fight. Proverbs 3 says, then you will walk in your way securely, and your foot will not stumble. When you lie down, you will not be afraid. When you lie down, your sleep will be sweet. Do not be afraid of sudden fear, nor the onslaught of the wicked when it comes. For the Lord will be your confidence and will keep your foot from being caught. For where the Spirit of the Lord is, there is freedom. The secret to happiness is freedom, and the secret to freedom is courage. Well, that's a wrap. If you like what you heard, please share. Want to hear more? Please subscribe. And if you are a faithful listener, thank you for all your love and support. Without you, I would not be here. I'm glad you are along on this journey with me. We have each other, and we are not alone. Tune in next time for part 4 of the hospital ovens and patient prisoners. Pursue health, live free, and breathe deep. Until next time, everyone, this is Dr. Toe, signing off. Important disclaimer. This podcast is presented solely for educational and entertainment purposes. I am not a medical doctor and I do not diagnose, advise, or treat. This podcast is not intended for the substitute of advice from a personal physician, professional coach, psychotherapist, or other qualified professional. It is not intended to be used or relied upon for any diagnostic or treatment purposes, or to be used as a substitute for professional diagnosis, treatment, or conventional medical therapy. None of the statements made in this podcast have been evaluated by the Food and Drug Administration. Please consult your healthcare provider before making any healthcare decisions or for guidance about specific medical conditions. Listen responsibly.